Thank you, Chairman Cox, and good afternoon. While we know there is considerable focus and energy in our community on the protest and the situation surrounding the unfortunate loss of life of Mr. Floyd and broader societal issues, our work around coronavirus continues, and our work to coordinate our effective response, monitor our reopening, and continue to move forward is ongoing. We also know that there is a number of things that continue to be in flux surrounding this, and so I just want to provide a quick clarification on the relationship between the state and the county at this point. Governor Gavin Newsom has announced that there will be local control of Stage 3 entities once the state of California provides what they call the how. He said the state will outline the how these additional entities can open by releasing guidance, industry-specific guidance. Once they release that guidance, then it will be up to county public health officers to determine the when. As it stands right now, we have not received any additional guidance since they made that announcement. Once they put out additional guidance for an entity, then Dr. Wilma Wooten will review it and will determine when is the appropriate point for San Diego County to move forward into that phase. And so we will certainly keep you posted not only on anything we hear from the state about what has been released, but also with Dr. Wooten's assessment of that guidance, along with putting the appropriate opening time or date here in San Diego County. In addition to continuing to look at opportunities for reopening, I want to share with you today, and Dr. Wooten's going to cover it as well, our triggers, our modified triggers that are guiding our reopening process. We've said from the beginning of this that our actions would be guided based on the data and based on the science. We have a number of things we've been sharing with you from the very beginning. We continue to adapt and evolve as we get clearer indications of the best way to measure the impact of coronavirus. And so today we want to walk you through the triggers as it relates to monitoring our ability to reopen. Our hope is and continues to be that none of these triggers are ever hit and that we can continue a gradual and smooth, safe, responsible reopening. But as we've also said from the beginning, it's important that we monitor the situation in real time and assess. Before I get into them, I will tell you that presently we are green. We are in a good position on all 13 of the metrics, all 13 of the measurements that are in our system, and we hope that that continues, and that's why we ask the public's continued help. The issues around physical distancing, face covering, hand washing, temperature check, screening, following the safe reopening protocols, following the guidance, all of us doing as much as we possibly can are things that will help us ensure that we stay in a green position and we can continue to move forward with phased reopening. The second thing I'll share with you before I get into it, and you will see it in a minute, is it's a little complex. It's a little nuanced. We have tried to design what we think best reflects the conditions on the ground and best reflects our desire to continue to stay open while being mindful of the public health dangers. And so there's a series of steps and triggers. And so I'm going to do my best to walk you through it. We may have to come back and do it again, but we certainly want to be very transparent. Dr. Wooten walked through this presentation at our Board of Supervisors meeting yesterday, but we wanted to share it with you again today in order to let you know what we are monitoring and tracking on a daily basis and what will dictate and determine our ability to continue to move forward and what things it is that might cause us to take some alternate actions. So we'll start with the first slide here. What you see here is the 13 triggers for modifying the public health officer's order. And you can see them in 3 different categories. You have them in epidemiology and surveillance. Second category in healthcare, that's basically hospital capacity. The third category there is in public health and the response. And then in each of those, you see the 13 triggers broken up into those 3 categories. Now, what is important to note is what would cause us to take some type of action. There are 2 different ways that we would be required to rethink what we're doing or reassess our ability to continue to move forward. We'll go to the next slide here. The first is if any of these 3 criteria are met, if any of these triggers are triggered, then we would immediately take some remedial action as it relates to our ability to move forward. Any one of these 3 are triggered, then we would take action. The first is community outbreaks. That's no more than 7 new outbreaks in a community setting in a 7-day period. Now, it is important to note that a community outbreak is not a congregate care setting or a skilled nursing facility. It's not a healthcare entity. It is a true community outbreak out in the community. So if we saw more than 7 new outbreaks in a 7-day period, that would immediately trigger that stage. The second one would be limited intensive care ICU capacity. We report this to you daily in terms of how we're doing as a region on our ICU capacity. If we were ever under 20% availability of ICU beds, that by itself would also trigger action. The third is around personal protective equipment. If only 50% of the hospitals have at least a 15-day supply of PPE over a rolling 13-day period, that would trigger. To be clear on this, it is any of these 3 criteria. Any one of these 3 would cause us to take action. What would those actions be? We'll go to the next. It depends on the action. It depends on a number of circumstances around what caused us to hit that trigger. But we have a range of options at the public health officer's discretion. The first would be industry-specific action. This could be an individual company might be closed because perhaps there's a significant outbreak or something that's happening there that's causing problems. It could be industry-wide, a certain segment. If there's clear and compelling evidence that a certain segment is causing problems, it could be that segment. It could be things tied to our healthcare industry. Maybe we dial back elective procedures or we do some other type of action, surge capacity, but it would be industry-specific actions that could run a wide range or gamut of options. The second thing, if we hit a trigger, could be simply pausing, which just means we're going to stop where we are. We're not going to open up anything additional. We're going to pause. We're going to monitor the impact on the metrics, and we're going to continue to evaluate where we are. And then the third and more drastic step would be countywide dial backs of entire steps that we've taken positive. Now, again, we don't want any of these things to happen, which is why we continue to move cautiously. We continue to move methodically. We continue to move slowly. But if any one of those 3 triggers I mentioned were hit, then these are the range of options that we could take under the public health officer's discretion in terms of addressing that. Now, there is a second way that we could also be forced to take action. Let's go to the next slide. This slide, again, has all of the original 13. And we highlighted for you on a previous slide, in a previous effort, we focused in on the 3 that by themselves would cause us to move backwards. Those 3 are number 2, number 7, and number 9. But in addition to any one of those, with the remaining ones here, if we ever hit a situation where 1 or more of the triggers in 2 of the 3 columns are met. So what that means is if you look at what is left there, you see 2, 7, and 9 are in a different color because those are standalone triggers by themselves. But let's say those 3 are still in a green position and they're good. We have not hit those triggers. If 1 or more of the remaining criteria in 2 of the 3 columns are met, then that would also cause us to take action. The actions that we would take for this triggering effect would be exactly the same as the others. So again, I know that it is a little bit confusing, and we will certainly walk through this multiple times, but at its core, if you look at trigger items 2, 7, and 9, if those are hit, that by itself is enough for us to have to take action. And I walk through the range of actions. If those 3 are green, we have not hit those, then if 1 or more of what is left in 2 of the 3 columns are met, that would also cause us to take action. We are trying to design a system that really takes into account a realistic condition of what's on the ground. We also don't want to have a situation that causes us to too quickly or too swiftly trigger and have to take action. And so although I know it comes across as a little complicated, it is based on a series of best practices, evaluations of other jurisdictions, consultations with healthcare leaders from a number of places, and trying to give us the best and clearest sense of our progress as it relates to a region. And Dr. Wooten's going to walk through where we are on these, and then we'll be modifying our presentations to be more aligned with regularly providing you the updates on where we are on these 13 triggers. So with that, let's jump into our daily update, our charts today. The first here, we have a new record for number of tests. Today, 4,940. We had a little batch come in from one hospital system, but we are hopeful that we continue to move upwards. but we're significantly over today our 7-day rolling average. We've had some challenges with the state testing system reporting back. Those tests are still being conducted. There's a little bit of lag in getting those back. But again, we want to get over that 5,000 number. We want to stay over that 5,000 number and continue to advance forward. Contact tracing continues to increase. We're now over 400, on the way to our initial goal of 450 at 408. And so that continues to work well. And then our public health motel rooms remain available for those in need of isolation treatment. In terms of our cases today, we're reporting 124 new positive tests, again, out of that 4,940 total tests for a 3% average, just barely de minimisly above our 14-day rolling average. Our 14-day rolling average is 2.9. Yesterday we were 3, today we're 3. Previous days we were 2. So again, this remains flat, which is encouraging. Next, we'll look at our hospital daily census in San Diego County. You can see ICUs down a little bit from yesterday, a little higher than the day before, but again, holding considerably flat along the line there over the preceding 30 days. Total COVID-related hospitalizations down a little bit yesterday from today, up a few from last week, but again, holding relatively flat. And then next, we will look at the, again, you have the COVID-related ICU census. This is our ICU hospitalizations. COVID ICU utilization at 158, non-COVID there at 294, and again, the ICU bed capacity at 64. Again, one of the immediate triggers we talked about earlier was if that ICU bed capacity, if the availability, if the ICU bed occupied were to go above 80%, that would be one of the triggers. So again, we are doing well in regards to that metric. That concludes my section of the report. I will now turn it over to Dr. Wilma Wooten for a Public Health Officer's report.